So this gentleman is here to see me for a recurrent hernia. He first had a small umbilical hernia that was repaired a couple years ago. It recurred a year later, and then he had a large incisional hernia repair with mesh, which recurred a year later. So now he comes to see me for this humongous incisional hernia. He's laying supine, so he's laying flat on the table. All right, sit up for me and show me this, how big this thing gets. All right, relax, don't pop. Good. So it goes right back down. And then when he relaxes his belly, I can reduce all these contents back in, and I can kind of feel the edge of the large defect here. There's a defect right there, and this is the edge. I can feel the fascial edge right there. And this is all defect here. This is just skin loss from the large bulge that sticks out and from the scar tissue. So let me have you do it one more time. All right, relax. Good. Appreciate it.